Our vision is that every place in Ireland will be accessible for an older person, but not just in the built context, that the experience that they get when they go there is age-friendly. That means that nobody's experience should be impeded because of their age.
Hello and welcome to another episode of the HSE Talking Health and Wellbeing podcast. My name is Fergal Fox, and today we're speaking about Age-Friendly Ireland and all the work that they do, and we're delighted to welcome Chief Officer Catherine McGuigan of Age-Friendly Ireland. Catherine, you're very welcome to the podcast.
Thanks, Fergal. Delighted to be here, as always.
So, Catherine, you've been working in this area for a good few years now, and you've been supporting information sharing and activity across a broad range of sectors under Age-Friendly Ireland. Can you tell us a bit about the organisation?
Absolutely. Well, Age-Friendly Ireland, I suppose, if we look at historically, Fergal, have been in existence for 15, 16 years at this stage. Established under the WHO Global Age-Friendly Cities and Communities Framework way back in 2008, 2009. What preceded that was the WHO had done a survey across the entire world, 33 cities, to find out what was it that we needed to be doing to plan for our ageing demographic. As we know, population ageing is rapid. Not only is our population growing, but demographic change shows that we're going to have more older people, but more older people over 80, and our longevity has increased significantly. So Age-Friendly Ireland went through a number of iterations, Fergal, but in 2017 to 2018, it moved into a shared service under the 2014 reform programme, which means it's hosted in the local government sector, but as you rightly say, is anchored in the principles of collaboration and partnership. So everything that we do across the whole country is built on partnership, but fundamentally built on the voice of older people. That's what we do differently. We consult with older people. We ask them to come in with a co-design. We've consulted with about 50,000 older people over the last 14, 15 years. And in addition to that, have delivered about 15,000, 16,000 initiatives, many of which have been scaled up and rolled out nationally. And a lot of those, as you know, are in partnership with the HSE. We were officially given the accolade of first age-friendly country in the world in 2019. By virtue of that, meaning all our municipalities were signed up to the WHO commitments. And I suppose what we have in place is a structure that is allowing us to be prepared for population age, which gives us that slight advantage. And I'm not sure if you've seen the OECD report the other day, but certainly some very, very good statistics coming out about older people in Ireland. Not everything's right and not everything's great, but we're certainly a little bit ahead of the curve in terms of how we have planned for that. And we've a lot to do, but we have a lot done and we've made great progress.
And it's very important that we make progress in this area for the particular reason you've highlighted there. Like, this is the way the world is going and we need to cater for an ageing population. I was watching one of your webinars there and somebody was presenting about ageism and how harmful that is. So we need to take this positive approach. I hadn't thought about ageism for a while, but it really is very dangerous in terms of denying people or impacting on people in a lot of different ways, isn't it?
I think it's so casual. Yeah. That's the worst thing about it. And that's what I found. And any other of the sort of discrimination sectors like racism or on the basis of gender are so topical, but yet we're very casually ageist. And it's almost like an unconscious bias. And we're happy to use a language that people find really unhelpful, you know, referring to older people as elderly and vulnerable, which they do all the time, unfortunately. And we've been progressing that work as well and asking our age-friendly ambassadors to kind of champion that. But it's also inherent, you know, where people think there's a negative. I don't want to tell you what age I am. I mean, I'll happily tell you, Fergal, I'm a 52-year-old woman and delighted to be celebrating that and talk about what I've achieved and what I hope to do in my life and that I've a lot of life in front of me. Very few people are actually engineered to share that. And it's still the sort of joke, oh, I'll not tell you what my age is. And also, I suppose we've found from older people consulting that there's a lot of even ageism towards each other. Is it not time you gave up work and you should be hanging up the boots? And I think what we need to do is change, first of all, the narrative, but we also need to change culturally the stereotype that we feel that there's a vulnerability, because the reality is we are all aging, we are all living longer. And if we're looking through the age-friendly lens, age-friendly does not do things that's for older people or an aging population. We look at universality across the life course. So if we're making accessibility to a public building or a hospital, we're talking about a child in a buggy can access it, an older person can access it, a person with a disability. So ageing is life, is across the life course. And we need to start seeing it that and really remove this negative stereotype that we have, because it is very, very harmful and it can actually isolate people, Fergal. And there's evidence in the WHO report that backs that up.
Yeah, it's something that we all need to be a bit more guarded of, because as you said, when it's casual, it can seep in. There's no guardrail against it. That we need to be.
Absolutely.
And we see it socialised very much in the media and with personalities and the way that people are expected to look, and that youth just seems to be a bit valued more, which is unfortunate. We need to change that. Can you tell me a bit about what you just mentioned there, the age-friendly lens?
One of the quotes we always go back is, when you design for a younger person, you exclude the old. But when you design for an older person, you include everybody. And that has really been an anchor for us since we started this process. So, for example, Fergal, as you know, Age Friendly Ireland have scaled up and replicated a number of age-friendly built and physical infrastructures like age-friendly towns, age-friendly hospitals, age-friendly parking, our public realm, our airports, tourism destinations. And our vision is that every place in Ireland will be accessible for an older person, but not just in the built context, that the experience that they get when they go there is age-friendly. Therefore, when we're doing that process with any of our age-friendly firsts, or any of, like, if you take, for example, Knockenshannon Airport, were the first age-friendly airports, actually, in fact, in the world, but they undertook a 2.5-year process. There's a whole process behind this, and you bring people in and you consult. But the walkability audit would have had people of all ages and abilities. And as part of that, they even put in a sensory room, and then the change in places, toilets in Knock and stuff like that. So that what you really are talking about is that everybody, no matter what point or what juncture they are at in their lives, that they can go and that they can have a positive experience, whether that's the built environment or whether it's the customer-facing service that they get. And that's what we need to go. Programme for Government, well, we're looking at a new programme for government today, Fergal. Previous programme for government had a vision of an age-friendly Ireland. And if we are truly realise that, that means that nobody's experience should be impeded because of their age. They should be able to go to a hospital, a primary care centre, a shop, a post office, a hotel, a swimming pool, anywhere, their local playground, their local recreation, their own house, no matter where they go, that their experience is no different because they may have something that has been related to their age. It should be for all ages. And that's what we do. There's a process behind everything we do, that it's informed and designed by older people.
Okay, we might get into some examples of the process, just like you gave us a few there in reference to it. But your support network or your engagement network is through local authorities. Can you tell us how that's done?
The shared service is hosted in Meath County Council on behalf of the local government sector. And each of the 31 local authorities across the 26 counties have their own age-friendly programmes. So in Dublin City Council, for example, there are 5 programmes. And then there are other local authorities in the Greater Dublin area. So as you know, there are 31 lead local authorities in the Republic. But what we would say is, while the custodianship of the programme sits there, the implementation of their local strategy is the responsibility of everybody. And the local authorities are seen as the coordination. So in each of the local authorities, you have a strategic alliance, which is chaired by the chief executive. And you would have very senior memberships from the HSE, An Garda Síochána, and that'd be the development company, transportations, the community section. It really, really depends on the consultation, but are those senior people who are come in to be innovators and can actually respond to the strategy. There's a programme manager at administrative officer level within the community section. There's an age-friendly technical advisor. There's an interdepartmental team. And more recently, there is the Healthy Age-Friendly Homes programme, which I know you're aware of, and is funded to roll out and support over 10,000 older people to remain in their own home. But fundamentally, there's an Older People's Council, and that's a very diverse range of older people who come together, a 2-tier approach, a big, wide group representative of everybody across the entire county or city, and then an elected executive, which would be representative. It would have that diversity in age, diversity in different abilities. So that the voice that we're hearing, Fergal, is really ensuring that we're not just finding what an homogenous voice coming through, that it is really representative of all the older people. And that's what the strategy is built in. They do an ultra-wide consultation across the entire county. What's working, what's not working, what can be approved, what can you do, what can others do? That is presented to the Alliance and then the stakeholders delivered. So there's an age-friendly strategy in each of the 31 local authorities, but the partnership and collaboration is across all the stakeholders, Fergal. They just are the sort of central coordination.
But the key principle that you said there is that you're going for diversity, inclusion, and consultation and participation from older people about their own geography areas.
Yes, absolutely. And when we started this process way back, it was key components were older people that were, yes, involved in groups. And, then you'll normally get very active people or very vocal people. But we also wanted to get the individuals. We also wanted to get people that were living in residential care homes who didn't necessarily feel part of the landscape or the fabric of their own community. We wanted to get the rural farmer, the 55-year-old with congestive heart failure that was finding it very difficult to either work or get access to services, people with dementia, people from minority groups. Over the course of the last 14, 15 years, we have expanded the diversity, not just in age range, but to make sure that those issues are coming through. Because if you want to be really representative, Fergal, you have to understand how those people are affected. So our strategies are a good reflection of all ages and all abilities. When we first started, I think the CSO data, Fergal, was saying 65 plus, and that was it. So everybody over 65 had the same needs and wants in terms of a statistic. At least now that is broken down and there's a recognition that at different ages and at different stages of our life, there are different needs and wants.
So those councils and that participation network, and as you said there, you're taking a health inequalities and inclusion lens. That's not easy to get effective participation there on an ongoing basis. So credit is due to the people doing that groundwork around pulling in those voices and encouraging those voices to be at the table. It's not easy.
I think it's really important that, I suppose, as part of the developmental phase when we were starting Age Friendly back in those earlier years, we really had program managers, and as they are now, had a real passion to find that voice. It's all about the principles of community development, Fergal. And the voices are there, but not necessarily people want to offer it. Or an awful lot of humility where people say, well, what do you want to hear from me? And I think when you empower people to realise what you have to say is really, really important. But I also think it was a principles. We didn't ask people to come in and lobby and complain and say this was all wrong. We asked them to come in and say, first of all, let's look at what's good. But tell us what's not good. And if we were doing it in a different way, what way would it work? And when people became part of that co-design approach, they were very, very invested in it, but felt very valued. And it is very valued. Everything we've done has been built on this voice and this authentic voice of older people. And it is authentic. They're seeing it as something altruistic piece that they could be given, particularly if they'd reached retirement, they were giving back. So what they're doing now is shaping not just an Ireland for the current population of older people, but for us and for our children, and more importantly for our grandchildren. What we do now impacts on how they're going to live.
Yeah, that's a very important shout out, isn't it? We're all going in the one direction in terms of age. So we're foolish not to be considering the needs, because they're going to be our own needs. Yeah. I was looking at your YouTube channel. I mentioned one of the webinars, but there's a lot of voices there from across the country of people that have been supported around a range of different initiatives that you've done or you've scaled up or supported the scaling on in areas like transport, healthcare, digital literacy. There's numerous areas. Is there any ones that you think would be important to highlight today for our audience?
At the minute, and not to get in too deep, the national planning framework is being revised. What are the big ticket items? Infrastructure, climate change, digitisation. We've learned a lot from COVID. We've learned about efficiencies, but we've also learned about how our health services and services can be delivered better. But digitisation, for example, Fergal, what we hear on the ground is, at the minute, and particularly because a lot of younger people are maybe natives of technology, there are a lot of older people that are not natives. Now, we haven't had a lot of adopters, but for example, the principle that I would always sort of use first is choice. If older people want to engage with technology, that's great. But if they don't, that has to be respected. And one of the things we worked very closely with the Department of Finance last year was the National Payment Strategy, and about this sort of thing, do we need to go cashless? And thankfully, that's not going to be the case, that we can continue to use cash. Because in reality, what does that mean, Fergal? That could be the reason for people to be able to go into the town, collect their pension, get their cash out, do their shopping, have that social interaction, go to the butchers. All of those things are really, really important in terms of engagement and keeping people supported. But then there are a lot of people who say, well, I can still do those things, but I can do it more efficiently with digitisation. And there are a plethora of training programmes and supports. We did the age-friendly tablets. There's training through our libraries. Our libraries effectively have become community hubs. Do you remember maybe 30 years ago or 40 years ago, libraries were places where you went in and you got a book and they were very quiet and, you were, shh. They're different places now. They are community places where people from all ages and abilities can go in and get any service. And they've been very, very forward in, particularly the Acorn age-friendly tablet, where people can go in and try it and use it and then take it home and come back and say, well, I think I'm going to invest in one of these because of the information that I can get. If you look at assisted technology like telecare, and particularly as part of the healthy age-friendly homes, we're using the little pans, which can trigger an alert for a fall. There's an accelerometer in it and it can trigger those. We've heard, testimonies for people where they have been life-saving. And I suppose years ago, there was less of an appetite. I am seeing that changing and it is a priority.
Can you tell me a bit more about the Healthy Homes initiative?
Sure. So Healthy Age-Friendly Homes started, I suppose, over the years we would have heard about. There's all levels of support coordination, Fergal. A public health nurse provides coordinated support. A tenant liaison officer in a local authority. A social prescriber, you could have a befriender. And there are all these different people providing different elements of support. But what we identified was there was a gap, I suppose, in joining the dots. And there was some of the models, I suppose, abroad and that we had looked at as part of a housing project up in Dundalk many years ago. There was some different models around how local authorities, one in the UK particularly, had come in and sort of consolidated the efforts to pull the needs assessment together. So we decided to work with Sláinte Care to say, look, could we identify a model? It's called the Healthy Age-Friendly Home. So we went out to 9 local authorities and we piloted this wraparound support person that would go in at a senior enough level, identify, use the assessment, identify all of the needs, and then provide the supports. And I'm delighted to tell you that was so successful. We did an interim report and then we did a final evaluation, which was launched last July and had such a huge impact on older people that it has now been scaled up nationally. So we have 44 healthy age-friendly home coordinators across the 31 local authorities, and they can basically go into an older person's home and conduct an assessment. And they look at 6 areas of that person's life. Well, there's no stone unturned, but generally they will fall in. The physical build of the house, whether there's longevity there, whether it's suitable to meet their needs as they age, whether it's in the right location, do they want to right size, do they want to look at split capacity, whatever the case may be. And of course, then there are policies there to support all of those. And adaptation, there's a huge demand on adaptations. Then there are health supports, and that might be access to a public health nurse, an occupational therapist. It could be the home help or the home support service, whatever the needs are. And we will link with the key people in the HSE to determine what those gaps are. Then they look at the technology. They also look at their energy, because as you know, Fergal, an old house and a sick house can be a very, very bad place for an older person, particularly with respiratory illnesses and falls and things like that. So they look at that, and we work with the SAI in that regard at a very, very deep level. And then they look at financials and safeguarding to make sure they're getting all their entitlements, but also it could be pensions, but it could be things around safeguarding. And we look at all of those supports as well. And then the other are the community and social, and they are in plethora. Are they engaging with all of the supports that are available to them in their community? We have a very intensive mapping piece done where we can identify what services are there and connect people in. And there's a little bit of, I suppose, facilitation in that, but then empowering the older people to take charge. If they want to get into the men's shed or the physical activity program or go into the library. And it's been so successful in terms of bringing together all of those different needs and creating the actions. Ultimately, what we can help, Fergal, is that we support older people to live in their own home.
And that's so important, like from a health service point of view. You're describing a service that's using a very useful framework to engage on these fundamental determinants of their health and well-being and keeping them healthy in their home. You people starting to use a wheelchair, starting to use a crutch, or starting to use a walking aid or whatever else it could be for different things. Like, it's so important, isn't it?
And that was the huge gap. If people ask me what was the real sort of critical success factor, and I think it was anchoring the role within local government, because local government provide over, you know how many services, right through from environment, planning, housing and all the rest. But the fact that an awful lot of the issues were arising maybe from the condition of the house. And in the first year, Fergal, the amount of actions that came out were actually relating to the actual layout and the issues with the house. Housing and health are inextricably linked. But all these other components build exactly what you're saying, is if we can make that better, that means a person's overall social determinants of health are improved significantly. So therefore you look at hospital avoidance, you look at frequent flyer reduction, you look at unnecessary admission to residential care. You can reduce that because oftentimes people prepare for fair deal when they've had a critical incident and they don't have the supports at home. So if you have these preparatory things done in place, you can easily have a critical incident and recover in your own home without having to go into residential care prematurely. That's the way we want to see it. Residential care is very much needed, but it should be there when it's timely and planned rather than being in a crisis. And if you've got this work done through healthy age-friendly homes, it means you could be proactive and have your supports in place.
Like you're even going to prevent falls.
Absolutely.
I always think that a little fall can just rapidly increase the aging and bring people to a different place in terms of their thinking and their well-being and their mental well-being.
Absolutely.
So having a better environment, you're improving every day of their lives, in every way.
In every way.
I can see,
and that's the key thing.
Yeah, I can see how if you had a good evaluation behind that you got the resources to upscale it. There's a variety of things. We don't have time to talk about everything, but I just want to touch on one of the pieces that my own colleague, Sarah McCormick, who's been working with you for a good few years now, got involved in terms of the health and wellbeing in the islands. Can you tell us a bit about that?
Yeah, I mean, Sarah is hugely energetic as your colleague and everything else. She's hugely energetic. But like that, she has this real vision that nobody is left behind and that there's a place for everybody on the pitch. And there was an island strategy through the Department of Rural and Community Development, but then there was obviously work through the HSE, and we put a little bit of money in how we could actually go out and sort of see what the issues were. And the first thing was, Fergal, to go out to the islanders and identify what it is that they feel is their decision. They have been involved in strategies before, but I suppose not in a really consolidated way or meaningful way. So there was a number of consultations that took place with the local authority, the HSE, and there are big ticket items like an access to broadband and stuff that we couldn't resolve straight away. There may be the longer term goals, but the low hanging fruit was that older people in the islands wanted to be very much involved in sort of health and wellbeing activities, those that did want to be, and they were able to prescribe what it was. So they did things like the activator polls and, physical activity programs. But other things were unearthed as we did that. So, for example, some of the older people weren't aware of the housing adaptations or how to go about that. There are things like you have to be LPT compliant, and some people weren't sure how to do that. There's language barriers. And we were able to come up with small solutions. And for a very, very small pot of funding, we were able to reach a huge amount of people across the islands. What we need to do now is to continue that work, embed that work, put it into existing work programs. Because I suppose islanders, they're native Irish people, but they might have bespoke issues that might not affect people that are living on the mainland as such. And all of those were taken into consideration. But I think what was really unique, Fergal, was a collaborative approach of the HSE and the local authority going out together to take that sort of holistic approach. It was neither, they were just looking at health and wellbeing because we're the HSE, or we're just looking at the built environment or community services. It was very much a blue skies approach and gave them the opportunity. And it has worked extremely well. That report is coming out and we will continue to work with the islands. And again, like that, if you look at a policy perspective, that's delivering on the national island policy as well, because it is engaging. It might be predominantly with older people, but it is engaging and it is looking to pick what are the big issues that are facing the island. We want to preserve the islands. That's one of the major things, and make sure that those people are living a very, very vibrant and fulfilled life and are aging at pace along with people on the mainland.
I'd like to commend you as well in terms of the centrality of the service, the voices that you're trying to get in on all the development. You're always trying to consult before you do anything. And if anybody wants to go to the YouTube channel, Age Friendly Ireland YouTube channel, you can see a range of older people's voices over the last couple of years. Came across some lovely pieces, even during COVID, where you were kind of celebrating older people in terms of their reaction to COVID and thriving during COVID and reacting, taking that digital literacy piece on, or as you said, engaging socially and maintaining their social engagement at that challenging time. Is there anywhere you'd like to signpost listeners to for further information, Catherine?
Absolutely. And I think just to pick up on your last point, a lot of very wise older people told me at the very beginning when I joined Age Friendly Ireland 15 years ago or 15 years plus, and they said, why don't people just ask us? It's very, very simple. Instead of a bunch of service providers sitting around saying, should we do this for older people? Should we do that? And that's exactly what we have done. And we've done that in spades. And if you just ask people, you can do great work. So yes, Fergal, there is, and I'm also always loath to point people to the website. But of course, if you go to the website, all the numbers and everything else are on that. And on the website, we have all our contacts. There's the contacts for Healthy Age Friendly Homes. I think if people are interested, I think the YouTube channel is fabulous. It's a great resource. A lot of interesting, as you see, some of the webinars, but even some of the short vignette videos about older people's experiences with the digital technology. So between the website, which is just www.agefriendlyireland.ie, And then the YouTube channel, if you just put in Age Friendly Ireland, it brings you directly to the YouTube channel. And then obviously, Fergal, we're based in Meath County Council, so we can use the generic telephone lines for that. So we'd be delighted if people got in, looked at our resources. We have such a bank of resources, guidelines, toolkits, YouTube videos. We have a weekly newsletter which goes out to thousands of older people and practitioners across the country. Similar to yourselves, Fergal, we will showcase everything that you are doing in health and wellbeing. The more we share information, the more information we get out there. And it's a great read every week, and it lets people know what's happening around their country. So all of that is available on the website. All of that is available if they want to give us a ring, use the old telephone line, which is always an option. And the YouTube channel, as I say, is a great resource.
I love the way that you're still using the phone line. You're not forgetting about it.
Absolutely. Well, I love to use the phone myself too.
Well done. Look, thank you so much, Catherine McGuigan, for your time today and speaking to us on the podcast. And just to thank all the listeners again, if you think anybody benefit from this episode on Age Friendly Ireland, please share it with somebody in your network or a friend or colleague. And thanks for listening to another episode of the HSE Talking Health and Wellbeing podcast.